The importance of oral health care has been stressed for many years. From children in classrooms to individuals on their regular dentist visits, dental professionals have encouraged brushing and flossing every day to prevent cavities and gum disease. Regular oral care has larger health implications. There is growing evidence of a connection between oral health and general overall health. Having a sick mouth can contribute to having a sick body. Given that inadequate oral care negatively impacts general health, there appears to be a crisis brewing in long-term care homes where residents are unable to get the oral health care they need.
This is, especially this long-term care, and I'm going to call it a crisis. I am going to call it a crisis. We have the baby booming population, so this is just the beginning. And this is only going to get much, much worse. So I think, I don't want to sound sensational, but it is a looming crisis. It really is.
The fact that our elderly population is steadily increasing from year to year, and these individuals, because of the different health problems that they do deal with, are unable to access dental care in the private practice setting. So we, as dental professionals, are being forced to come to them. So being able to provide that oral care. And one thing that we're trying to work with, and it's very difficult because at the education level, this is where I think they need to learn it as far as the students with nursing or long-term care workers, and being able to collaborate with dental professionals to be responsible with the oral health of these elderly individuals, because they're currently not receiving any of it or very little of it within long-term care.
Dr. Raju Bhargava, a dentist who has been practicing in Saskatoon for many years, has seen the connection between oral health and overall physical health.
If you have a mouth that's deteriorating, has deteriorating gums, deteriorating teeth, you have a lot of gum inflammation, teeth that have infections, that this is leading to an increased generalized inflammation contribution coming from the mouth.
Dr. Tim Donnelly is a leading expert in the treatment of gum disease and an international speaker who teaches dentists and hygienists around the world state-of-the-art dentistry.
And as it turns out, people that are susceptible, that develop gum disease, their body responds to that bacteria by actually increasing the amount of inflammation in the mouth. And it's that inflammation that results in the breakdown of bone, the teeth get loose and the teeth come out. In the effort to try and find out if periodontal disease causes heart disease, for instance, what researchers were able to document without question is that when the mouth is inflamed, that inflammation actually spills into the systemic circulation. To put that another way, inflammation in the mouth contributes to the overall level of inflammation in your body. At about the time we were discovering that, medicine was really hot on the fact that inflammation itself, systemically throughout your body, is linked to the very chronic serious diseases of aging. The typical diseases that rob us of the quality and the quantity of life later in life: Alzheimer's disease, arthritis, things like diabetes, heart disease, those type issues. While inflammation doesn't necessarily cause the development of those diseases, certainly inflammation is the fuel that drives those diseases later in life. And it turns out that there are a lot of lifestyle factors that play a role in developing that level of inflammation. What we now know is one of those lifestyle factors is gum disease. If your gums are chronically inflamed, and it rarely causes discomfort, you can have gum disease and not even know it. If your gums are chronically inflamed, daily you're increasing the amount of inflammation systemically in your body. Well, the body doesn't care where it comes from. If the level of inflammation rises, you put yourself at risk for the development of these very serious chronic diseases.
Poor oral health is more likely to negatively impact general health for those with pre-existing medical conditions, especially the elderly, in long-term care. Leslie Topola, manager of the Oral Health Program for the Saskatchewan Health Authority, has made a career in oral health care since the 1970s. With experience as a dental therapist, oral health care educator, and a healthcare manager, she is uniquely qualified to speak about the risk of complications from compromised oral health care, especially for residents of long-term care homes.
The long-term consequences of poor oral health for long-term care residents, there's kind of two categories for that. So similar to ordinary people, they can experience cavities, they can experience gum disease, or what we call periodontal disease, and gingivitis. They can have their oral conditions exacerbate other conditions they have. It can affect cardiovascular disease. It can affect their respiratory health. They might end up with aspiration pneumonia. There might be oral cancers that come from not properly looking after your mouth. Again, xerostomia or a dry mouth. And all of those conditions, and including poor oral health, so not having, your teeth cleaned or your gums cleaned, will eventually lead to things like pain and infection. And for long-term care residents who are experiencing pain, if they can't communicate that for whatever reason, maybe they've had a stroke or they're not able to communicate that, they can become quite non-communicative and they can become quite combative. So it affects people that way. And again, infection, if you have an infection in your mouth, it is spreading throughout your whole body and again can have impact on other conditions in your body and certainly have a serious effect if you're an older individual.
There's good solid research demonstrating, quantifying the amount of inflammation orally that is contributed to the systemic burden of inflammation. There's evidence certainly associating periodontal disease with a whole host of systemic conditions, strong links between periodontal disease and an increased risk for cardiovascular disease or stroke, increased likelihood for gastric ulcer recurrence if periodontal disease is present, respiratory diseases. Boy, a lot of the respiratory diseases that are so common in long care patients, there's a growing belief that maybe that's because nobody's ever brushed the teeth of the patients in there, that the pathogens orally find their way into the respiratory system and result in an increased rate in things like respiratory disease that are really difficult to control and zap the healthcare cost system from a lot of different levels. We now know clearly that oral inflammation is a recognized risk factor itself for heart disease. Fascinating studies done where they look at patients that have unfortunately succumbed to a heart attack. They cut open the vessels, they look in the vessels, and they find bacteria that can only come from the mouth. It's oral bacteria that they find in the vessels that shut down the blood flow that lead to things like heart disease. Clearly, by minimizing the bad bacteria in a patient's mouth and keeping it at bay over life, has a cardioprotective effect.
There's so much bacteria that lives in your mouth that to keep on top of that and to keep your mouth and teeth clean is really important. And then also your teeth look way better if you have good oral hygiene and your breath is much better as well. So for all of the above, all of those reasons, I think that it's good for your overall health.
For residents of long-term care homes, neglected oral health can contribute to serious health conditions, but there are also other negative consequences. Carrie Krieg, an oral health long-term care coordinator for the Oral Health Program for the Saskatchewan Health Authority, has spent many years working with residents in long-term care homes. Bev Leonard is a registered nurse and manager of a long-term care home.
If they can't chew their food properly, if they can't speak properly, if their interactions with people are diminishing because of that, it affects their whole quality of life.
Yeah, their self-image is impaired and their day-to-day interactions with everyone. And there's lots of people here and lots of activities going on, and we want people to be able to feel self-assured and enjoy interacting with everybody and going to everything they want to go to.
And all those things, if you start adding them up, if you have pain and infection, or you can't chew, it affects how you chew, and so you can't chew properly. So you're not going to eat nutritious food, or you're maybe not going to eat very much at all, if at all. It can affect your speech. It can affect your ability to concentrate, depending on the communication skills of the individual. That can certainly have an impact on their social contact with people and their ability to have a good self-esteem. If they have dirty teeth and their breath smells, they're not likely going to be wanting to speak with people or smile or have any social interaction. And all of those things then impact on the health of that person and their quality of life as well.
A fascinating link is with diabetes. If you have diabetes, you're at increased risk for disease development, and periodontal disease is on that list. Classically, periodontal disease is a recognized side effect of diabetes. We've known that for some time. What we now know clearly is if you have diabetes and you have periodontal disease, which you're likely to have, and if you have that periodontal disease not only eliminated, but successfully kept at bay, you actually can improve your blood sugar control. We're seeing third party pay attention to that. Payers at the insurance level are realizing it saves an incredible amount of money in overall healthcare costs if we tend to the contribution that the oral cavity is making to overall health. And diabetes is a clear example where it can make a dramatic difference. If you think about that, the reality is that a stop at the dental office to partner with a dental hygienist might not be the first stop in terms of managing diabetes, but boy, it sure should be the second. It sure should be the second. That's a lifestyle factor that actually dentistry now has the ability and the expertise to control and to do it well.
Lorraine Sutton, the daughter of Stella Sutton, a resident of a long-term care home in Saskatoon, saw her mother pay particular attention to her oral health care.
Then it was time to take care of her. And she was very adamant about staying healthy, protecting your eyesight, your teeth. She spent thousands of dollars on her teeth because she believed in the importance of keeping your own teeth for many reasons. It allowed you to eat a variety of textured foods. It just allowed you to stay healthier. And it has proven to be true.
Prior to entering long-term care, many aging Canadians face the reality that oral health care becomes more difficult, primarily for economic reasons.
But what happens is as soon as a person retires, there's sometimes a change in their dental plans, a change in their income, a change in their ability to be able to get dentistry like they were getting done when they had a couple of incomes and 2 dental plans. So you get a decline in oral health as soon as a person retires, right? So the residents we see here, their oral health was probably starting to deteriorate probably 5 years before we see them. But that doesn't mean that even though they may be in not a very good state of oral health when we see them initially here, I think what's important is that we can first of all assess what their oral status is like once they get admission, and then help them again get back to a good standard level of oral health and oral care.
Seeing the passion and the dedication from all these professionals that are all self-regulated. They are doing them themselves because they feel it's their professional obligation. So when I hear these stories about dental assistants and therapists and hygienists and dentists doing work in long-term care, a lot of it is out of the goodness of their own hearts, really.
Another factor making oral health care difficult in long-term care homes is that compared to the previous generation, there are many more current residents with their own teeth instead of dentures.
When I did my oral health assessments for Sherbrooke in particular, it was about 70% had some natural teeth to 30% were denture, full dentures. There's lots of partial dentures, but when there's partial dentures involved, we consider that they have their natural teeth. So that's how we categorize them.
The reason long-term care dentistry now is become more relevant to dentistry is that 20 years ago, 15 years ago, the majority of long-term care residents didn't have any teeth. They had dentures. They were edentulous. So their oral care wasn't relatively difficult to acquire. What's happened in the last 5-10 years and what's going to happen in the next 20 years is that all of us are at the tail end of our dental care, but you being at the beginning of your dental career, you're just going to start to see the baby boomers reach the retirement age, and in the next 20 years, they're going to be ones entering long-term care. There's going to be a huge influx of long-term care residents, and the issue is that the baby boomers are those people that took really good care of their teeth.
Both my parents are gone. Both had full dentures. My dad lived in long-term care over 20 years ago, and then that was the normal, you know. Everyone had dentures, so everyone got their teeth taken out, and everybody got their dentures brushed.
And in fact, there's already impressive studies that demonstrate doing something as simple as periodically determining a long care patient's overall health, and even in the most basic fashion, interceding. If someone checks them periodically and debrides their teeth, we see impressive reductions in things like aspiration pneumonia. Certainly, we want to be able to help patients, to help healthcare as much as possible. One of an easy solution, especially in long care patients, is get the personnel that are trained or have the expertise to determine the oral health status, and on a regular basis, evaluate these patients and provide the care to get that inflammation to resolve. Sometimes it's as easy as brushing the patient's teeth. There are patients in long-term care over long periods of time, no one's ever looked in their mouth. Unfortunately, many times these patients don't or can't complain about symptoms. Oftentimes there aren't even any symptoms. We're clearly finding out that that undiagnosed issue is driving up a lot of healthcare costs. It's reducing greatly the quality of life. It's taxing a lot of the long-term caregivers.
Is there a way to address the hidden problem of oral health care in long-term care so residents receive what they need and the healthcare system is not overwhelmed by preventable health complications?
I think maintaining oral health, it's probably a window to a lot of other healthcare issues and things that you should be checking out in your body. And so if you know your oral health care is good and you're keeping up on it, there's probably a lot of other things that you're checking up on and keeping an eye on.
The lack of adequate oral health care for long-term care residents in the province prompted the creation of the Saskatchewan Oral Health Coalition.
The overall goal of the Saskatchewan Oral Health Coalition is basically to identify and address the needs of vulnerable populations. And we use that in an evidence-based approach, or what we'd call best practice. And we do a lot of advocacy and education, networking, and working on opportunities to prevent dental disease for the general public. So working with the Saskatchewan Oral Health Coalition, the Saskatchewan Oral Health Professions Group, the goal for long-term care is to actually be able to implement a consistent standard across the province of Saskatchewan related to improving the oral health of long-term care residents. There is a whole list of members that are available on the website. We have about 90 to date.
The organization used an Australian template as the basis for the Better Oral Health in Long-Term Care Best Practice Standards for Saskatchewan. The document created a strategy for implementing sustainable oral health care in long-term care homes in the province. When a resident enters a long-term care home, their oral health is assessed and recorded by a qualified staff member. An oral health assessment is then performed every 6 months to ensure the resident's quality of oral health is continuously monitored. Each resident receives a daily oral care plan, The resident's plan is placed where it can be seen and easily followed. The resident takes on as much of their own oral care as they can. A care aide provides any required assistance for each resident's daily oral care. When a resident is identified as needing further oral treatment, family is notified and arrangements are made. Treatment can occur either at an on-site dental facility or from a dental health professional group that visits the home. Putting a comprehensive strategy into practice requires many pieces to fall into place.
The keys to being successful in implementing oral care and long-term care, there's quite a list. What we have found to be the most successful is to have an oral health professional, in this case it's a dental assistant, who's hired as an oral health long-term care coordinator. And she is the person who goes in and teaches, trains nurses, nurse practitioners, other staff to do assessments and to know what to look for, to know what's healthy and what's not healthy, and to know when to refer. And then she provides the ongoing mentorship and support for those people to train other people, so to train actual frontline staff to do daily care. And this is both a theoretical and a hands-on approach. And there's lots of mentoring and assistance provided.
This was introduced to a couple other homes before Sherbrooke, and now you're on board. We just want to spend a day together doing some PowerPoint presentations and some DVDs. After lunch, we'll meet together and we will start doing some oral assessments of the residents that are in your homes.
Classroom education is important, but putting the best practices into effect requires hands-on experience with one of the most vital parts of the program, daily oral care for individual residents.
Hi, Rex.
Hi.
How are you today? My name's Carrie.
Oh, Carrie.
Yes.
I see, and you're the oral health coordinator. Well, it's nice meeting you.
Yeah, you too. I brought Deb with me today too, your nurse. Good
Hi,
to see
Debbie.
you.
It's nice to meet you also. So if I have any aches and pains, I can come and see you.
That's the one.
Thank you ever so much.
So, Rex, we're starting a new program here, checking every resident that's in the home, how their oral health is doing. So would you be all right if we did that for you today?
From what you have said, I think you've got a very, very worthwhile project on here, and if I can assist in any way, please allow me to help.
Okay.
Because it's good.
All right. So I'm just going to go get my gloves and my mask, and we're going to get you to come into the washroom, and we'll check your mouth out for you.
Sure.
All right?
Yep, that'll
right
be
back.
just fine.
Okay. Thanks, Rex.
Thanks.
So there's a few things I'm going to be checking, the outside of your face, and then I'm going to check the inside of your mouth. And Deb's going to be writing things down on your oral health assessment, and it's going to go into your binder. And then we also will make up a daily care plan that we'll put up on your mirror so that the care aides know that you can take care of your own teeth. Is that correct?
That's correct.
Yeah, you take your denter out and clean that, and then you clean your own teeth as well?
Yes.
Okay, perfect. So I'm going to get you to stick your tongue out at me now. Oh, nice, clean, healthy tongue. Perfect. You can put it in. Good. Now, the next thing I'm going to be checking is your gums. I'm just going to lift your lip down here a little bit. Oh, nice dental work you got in there. You've been taking good care of those teeth, haven't you, Rex? Yeah.
Mm-hmm.
From the students' perspective, I think they see a whole new world of dental hygiene care. There is no dental clinic there, so any work that's provided for the residents is provided in their own rooms. They're either sitting in a wheelchair, the residents, or in their beds. And the students, I think, see it as a very positive part of their program because they really think and see that the residents enjoy them coming. And the residents tell them, I love to see you. My mouth is clean. It feels really good.
Frontline workers require one-on-one training and assistance in order to properly provide daily oral care to residents who require assistance.
I was just visiting with Anne the other day while she was getting her teeth cleaned. And the hygienist said she could use a little bit of help with her brushing. So I just came to give you some pointers today, that's all.
Some residents have particular limitations like visual impairment that require unique training for care aides helping with oral care.
I met Lisa about 3 years ago, and she had been introduced to the Better Oral Health and Long-Term Care program, and at that time her vision was starting to fade on her and hasn't been the best. So we really worked with the care aides to understand that she needed to have some help with her brushing and flossing her teeth because she couldn't do it on her own.
For residents with a visual impairment who are still able to do much of their oral care, it is important that care aides take time to describe the procedure so the resident can fully take part in their own oral health care.
Here we go. I'm going to do the front one at the top first, okay? There we go. Awesome. So now we're here with Bobby. Bobby lives here at the Park Ridge Long-Term Care Home as well, and he's lived here for about 5 years. We've asked Jerry to come alongside us today because he's his main caregiver that helps Bobby with a lot of the things that he cannot do for himself because of his visual impairment.
It's right there.
Okay, so start brushing my teeth?
Yeah, you can start now, and I'm going to give you a cup of water.
And he knows your voice, right? So
Yeah, then,
you
of course,
don't
you
have
introduce
to,
yourself
you
and,
introduce yourself every day so that he knows who's in your room, right, Bobby? I've seen those signs around your room saying, please introduce yourself when you come in, right?
Yeah.
Even with the best possible daily oral care tailored for each resident, there are situations that arise where more extensive diagnosis and treatment are necessary.
I think it's really important for number one, your breath, because I'm obsessed with that. Like I brush mine usually about 3 times a day. Having white teeth, which is another obsession of mine. And if you don't brush your teeth, they're not going to be white. And I just learned about cardiovascular, that it's really harsh on your body as well if you aren't brushing your teeth. And that's very important to me to be healthy as a person. So, yeah. I am going to encourage my parents to take better care of their teeth as well, learning about all this.
Even when residents receive daily oral care, other more extensive oral health procedures are necessary from time to time. 2 pilot programs were established in Regina and Saskatoon to provide such care. In Saskatoon, a long-term care home employed a unique mobile dentistry model.
And the only reason you would take dentistry out of the office is if there's a need for it. And long-term care dentistry across North America, what we're finding is that there's a huge, not only a neglect with oral health, but also a void in getting dentistry. And the reason is because long-term care residents, 80% of all long-term care residents have some form of dementia, Alzheimer's, and what that creates is an access to care issue, where with their dementia, they are not able to go to a regular dental office. With our mode of delivery in using mobile dental equipment, what you're seeing here is our residents then have to be in Broda chairs, which simulate a dental chair as the best that we can, not having a dental chair here. But it works quite well. Ergonomics, of course, is a bit of a challenge, but you can actually do basic dentistry without having a dental chair or a dental light. Dentists will use loops, which are on their eyes, along with a surgical light that allows them to be able to see within the mouth.
In the mobile dentistry model, coordination between the dental team and the care home's medical staff is essential.
First of all, we like to start off with a bit of brushing. If you could zoom in on that. And we typically just brush their teeth. Often we see food particles, breakfast, lunch items on their teeth, and then this is a quick way just to introduce something in their mouth before we actually start the hygiene appointment. And as you can see, we're always holding hands, we're touching, we're relaxing them as much as we can. And once we've done this part, they seem to settle down. The clients seem to settle down, and we're able to do a little bit more treatment for them. Physically, it's extremely ergonomically tough on any dental professional to be doing this work in the long-term care. It's not a typical environment that we're doing this in, and so, you know, the patients aren't laying down. It takes a long time for us to do it. We need many breaks, and often it takes 2, sometimes 3 hygienists to be working even on one patient to get the treatment completed.
The other important thing is with a person like Rose is that physically she's unable to get to a dental office. So if dental team isn't able to come and look after her mouth, look after her teeth, there's no way that she'd be able to get dentistry done. Plus, a lot of the residents too that we see have sedation on board is that if we didn't come where they call home, again, if you tried to transport them to a dental office setting, what we accomplish here from a hygiene perspective, from a dentistry perspective, you would not be able to achieve that in an office setting because just the change of setting, the transportation to a dental office is enough to throw a huge curve in their life. To try and do any dentistry for them in a dentist's office would be impossible.
We've seen our clients here age and go into long-term care. Once that happens, it just seems there isn't a mechanism for them to continue their professional oral health care. Even if they have a family member that's able to make the appointment or transport them to our clinic, sometimes the very reasons that made them go into long-term care prevent them accessing dental care on the outside. It makes it problematic.
In Regina, as part of a pilot project, a dental care suite was built. The pilot was so successful that the dental facility became a permanent fixture. Dr. Maureen Lefebvre is an established Regina dentist who was instrumental in the process.
We're entering into our 10th year, and we no longer, of course, call it a pilot project. We now call it a program, so we're the Seniors Oral Services Program of Santa Maria. We have an on-site suite, which is quite unique, and that was one thing that we did push for in the early days. When we initially started the pilot project, there were 2 things that we wanted to address, and one was to do assessments and get a feel for what was out there, because again, there was a lot of misnomers about seniors' oral health, that everybody assumes they have no teeth and that there are no issues. And second was, once we identified the issues, how were we going to be able to provide treatment? It was not enough in my mind just to recognize there's an issue and leave them abandoned. It was, what are we going to propose as options to fulfill that need? So that's where we really pushed to try and have an on-site dental suite.
Despite having a full dental suite, working with long-term care residents provides challenges not usually encountered in an average dental practice.
This is our operatory. When a patient comes in, we actually call them residents throughout the home. We have them sit in the chair that has armrests on it. The residents are always in our site. We're always in this room. We never do leave the room to do anything. We do have, we take the x-rays, and we have transfer means in place. So if a resident needs to be transferred into the chair with a simple transfer belt, the staff as well come with transfer lifts. And this home has full lifts or sit stands.
Today, right now, we've got Roxine Harris-Swain in the chair, and Roxine is a resident on the 2nd floor, which is our dementia ward, and we also have her husband present for the procedure today, Doug Swain. So we always invite family members to be present. A lot of times they do offer support for their loved one. And when we do have a dementia patient, it's nice too, because we do have a means of communication, and it is calming to the resident when we change their surroundings, even though they have been to the clinic before. So we're gonna go ahead and start our treatment for today. Okay? You ready?
Yeah.
Set, go?
Let's go.
Okay.
Let's go.
Yeah. You don't feel that?
Yes.
Do you feel that? Is your lip feeling funny there compared to here?
You bet.
Okay, let's get a bite block in. So when we're doing treatment as well, we routinely use a bite block. It's not very common that we will use a rubber dam, though I do use them routinely in my private practice. And why? Because just logistically, the treatment is a little bit more challenging to deliver here. But we do use a bite block just so that they don't clamp down, and if they do doze off, that it just allows us to work without worrying about them clamping down. We always tie floss just for safety reasons. And then Patricia is always watching hands so that if someone does randomly come up or move, that we're on top of it just so their safety and our delivery of care is not tampered with.
Does access to oral health care in long-term care homes really improve the health of a resident? And are there other benefits like saving healthcare dollars as well?
I think for myself, it's a bit of a more spur to not only take care of my own oral health and to be more disciplined about flossing and brushing, but to I have older grandparents, and so yes, okay, maybe they didn't know that before, but I don't think it's too late to tell them now. And even going and visiting your older grandparents in nursing homes, it's something to check for, I think. So something as little as brushing your teeth.
Well, actually, my mom was a dental assistant, so yeah, so I've been well-versed in oral health care for most of my life. But I think, it's one aspect of your health care, and I don't know why you'd neglect that one part of your body, because if you look at if you're thinking about health holistically, everything impacts everything else. So you'd want to take good care of your mouth so that you can, and your teeth, so that you can take care of the rest of your body.
The Better Oral Health in Long-Term Care Best Practice Standards for Saskatchewan was implemented in 2 long-term care homes in the province. An assessment of the effectiveness of the Best Practices Initiative followed the oral health status of 177 residents over a 6-month period. By the end of the 6-month study period, the Oral Health Assessment Tool scores for the measured aspect of oral health had all improved significantly. During the assessment period, 55% of residents were referred to an oral health professional for more comprehensive examination or treatment. This is treatment that could easily have been missed without the continued oral care and assessment provided. Overall, 40% more residents had a clean mouth, no food or tartar in their mouths. Because of the link between oral health and general health, this means that there were fewer risks of health complications.
An integrated oral health strategy will benefit long-term care residents because it will improve their oral health. It will improve their overall quality of life, so again, improve their self-esteem, their ability to eat, their ability to sleep, their ability to concentrate.
Important for government, a small investment in preventative dental care can yield a large return in dollars saved on medical treatment.
We're finding out that indeed it's a tremendous cost savings. When you look at the long-term cost, healthcare management of our population as it ages, if you can get them to where they have a preferred level of oral health and you afford them the level of care necessary to maintain that, they save tremendously on the eventual healthcare costs to keep their overall health. We're finding third-party payers. The actuaries are looking at the numbers and are determining there are significant cost savings over the life of a patient if they are able to receive adequate dental care.
The governments, they like to help too. They like to do things, but they need guidance from the people that know what to do. And these professionals, these oral health professionals, they know what to do. And they will fix this problem, and they will, save taxpayers in Saskatchewan millions of dollars by doing it.
It costs $30,000 to treat aspiration pneumonia in the United States for one individual. So if there was 1,000 individuals, that now becomes, close to $31 million of what that actual cause and effect is. Yet if you could provide daily oral care for that 1% of people, so they didn't end up with aspiration pneumonia, even an amount of it, you could save, close to $31 million. So while the United States Medicare or Medicaid costs are probably higher than in Canada, the cost-benefit difference would still be similar in Canada, that there's a significant amount of money to be saved in healthcare costs if you implement daily care for residents. And that's just using aspiration pneumonia as one example. There's cardiovascular disease, there would be cancer, and a variety of other diseases as well, diabetes.
What that means is, and it's admittedly a difficult leap for governmental coverage, for healthcare coverage, the evidence suggests that if in fact you extend coverage for dental services aimed at getting patients inflammation-free in their mouth, it pays great dividends beyond the benefits in the mouth. It saves tremendous dollars in healthcare costs. We're seeing that at the private level. We're finally seeing awareness at the governmental level that affording coverage for care aimed at improving oral health has dramatic benefits that not only justify the oral health, but actually pay dividends to overall health as well.
There are many clear advantages to long-term care residents when homes incorporate better oral health in long-term care strategies. Improved oral health, improved general health, and a potential saving of healthcare money that comes from fewer residents having costly health complications. When so much is at stake, can we really afford to delay implementing a best practice strategy for all residents in long-term care homes?
It's very easy to prevent dental disease, but it still exists as a major problem in the world today.
Anything that you can do to make it less likely that you, the caregiver, let alone the person affected, is going to have to deal with that, I'm telling you, that makes a difference in life.
But our hope is that, they can grow elderly with dignity. And for a lot of them, this was important to them. And I think that's just honoring that this was important to them. And like we see tons of patients that come in, they've got, Crown and Bridge, they've invested time and they had a relationship with their dentist. And just because life has steered them this way doesn't mean that should stop. There should be some kind of a transition that continues with that.
I'm so happy to be in this aspect of dentistry. I think this is the future of dentistry. We're clearly in the age of serious dental medicine, where we know we can make a difference in patients' overall health. I'm happy to be here. If I'm leading the charge, I accept that responsibility. I'm also quite pleased with the fact that there's a lot of people very close in step with me, moving in the same direction. We're making a difference in patients' overall health.
It's a professional obligation for dental hygienists to provide competent and safe care for people of all ages, children to older adults. But by the time we've been there 3 times, some of them choose to go back and see their resident on their own time. We're always thinking that's wonderful. The residents are in a lot better shape when they have oral care.
If we want to look after older adults, we have to go where they are. And you start to go where they are and you realize they can't come where we are. They need to know that when people are coming to see them, that they look their best. They're welcoming, they need to know that their breath is fresh, that their teeth are clean, and that their smile is a smile.
The model, I think, for oral health care is, I think Saskatchewan is not just a good model for us, but it could be a good model for a lot of provinces that face our similar access to care issues, for sure. I'm glad to know that they're doing the work, because I know that by the time that my parents go to a long-term care, which they most likely will, they'll be taken care of because of these people. So, and myself as well. I mean, I know that I'll be taken care of because they'll be there.
We know the link between oral health and general health, and this is becoming a serious issue that has to be addressed at one time or another.
It's a very good setup, and I can't understand why they're not all like this. But maybe that's what they're working towards. Let's hope. There we go. Good job.
Best smile you have.
Right on. Looking forward to that coffee later, Mommy. I promised you coffee.
Good.
Yeah, you got
got good grip there on those gloves, right?
Oh, I hope so.
Yeah.
Good enough for a toothbrush. Really.
Yeah, that's right. We want you to be able to do as much for yourself as you can
Okay.
when you're in the home here.
Oh, so the gals that work on our team are the best.
Yep.
Right. Yeah, so that's.
The living, whatever you want to call it, out of it.
I thought you weren't going to say that. You were going to tell them.
I forgot. Oh, I goofed that up.
Thanks so much for letting us do that for you today.
Want to take a photo of my medals?
Maybe we should.